Professor Gervaix, thank you very much for accepting to do an interview with us, with the SNIS. And it's related to the prize that an article that you and quite a few co-authors wrote and published, talking about quite an interesting dispositive, if we can say. We'd like you to tell us more about how this device, which in appearance is only about health, actually combines several dimensions.
You probably know that 500 million people worldwide are affected by acute and chronic respiratory diseases. And that diseases represent really the biggest burden for the healthcare systems. In the same time, there is a shortage of doctors, or especially in low and middle income countries. So how to help patients to correctly be treated wherever they live, in cities or in remote areas, if they are poor or that rich, at the same level of accuracy and confidence. So that's why we developed a medical device called Pneumoscope that basically allow the recordings of lung sounds, of the blood oxygen saturation, and all these sounds and data are analyzed by artificial intelligence that can autonomously and in real time give a diagnosis and assess the severity of the disease. That means it's so easy to use that everyone, you, a doctor, a patient, everyone can take this device, put on his thorax, and then the recordings of the lung sounds are analyzed by artificial intelligence. And this really, it's a big help because everyone can use it, and this is not only the doctor's business.
So is it the equivalent of what we could say, what we have now as a thermometer?
It's more, because the thermometer only gives you a number. It gives you, okay, your body temperature is. Here it will tell you, this is the sound of a pneumonia. And the pneumonia is very severe, so don't stay home, go to the hospital. Or if this is for asthma, the Pneumoscope can tell you, yes, this is asthma, but this is not very severe. So maybe you can start the treatment and then you record your lung sounds 20 minutes later after the treatment. And then again, the Pneumoscope can tell you, oh, after the treatment you improve. So there is no need to go to the hospital. You can stay home. This is not only a diagnostic tool, but also a monitoring tool. It will talk to you. It will be interactive. And this is the plus, the added value of the artificial intelligence compared to a single thermometer.
Can you tell us maybe a couple of lessons learned from the process of coming up with this invention?
We built up this device with patients, with the end users. We went to these people and said, what do you need to do a better treatment or to better diagnose this and this disease or to monitor your disease at home when we were talking with patients. And they said, we need these features in the tool. And then we build up this device based on what the end user told us about their need regarding the disease.
Your article mentioned several contexts from where you trained the artificial intelligence. Did your team on purpose look for more resource-deprived contexts or contexts where people maybe don't get to the hospital?
Absolutely. Basically, the project was made for low and middle income countries because the WHO, say maybe 10 years before, helped us to fight pneumonia because this disease kills a child every 40 seconds. We say what we could do for improve the survival of these children. Then the idea first was this one. And then that's why we didn't do our study only in Switzerland, but we were over 3 continents, in South America, in Africa, in Europe, and then in 10 different countries. And then we included in our study more than 3,000 patients, as I said, in Africa, in South America, in Europe, because we would like to be sure that this tool could profit the maximum of people. Not only one specific population, but really everybody.
What about the policy process? I mentioned that policy is something that is important for the IG Jury Award. How do you see this research encountering the policy questions?
The policy is made by the WHO, by other agencies, and we try to answer their questions. Of course, at the end also, this policy have to be endorsed by the politics as well. That's why also in this country, we are talking with the Ministry of Health to try to implement this new device in the country. We need the support of the government. Let's say in high-income countries, everybody can pay, or the health insurance can pay for this kind of device. In low and middle-income countries, this is a bit more difficult. So we need the politics of your agency, of biggest agency, but also from the government to endorse the project.
Where are you at actually in the bigger project that this device is?
We are very small. We try to get more visibility, but we are talking with the Ministry of Health of Democratic Republic of Congo, in Burkina Faso, in India as well. So we are talking with these people, and we are also actually launching not only clinical studies, but also acceptance study by the end users. So we are really now on the field and to see if this new device really is what they need, what the healthcare workers and other people need.
And because we talk about new devices, of course, there is an economic dimension to it.
Right.
Is there a plan to maybe eventually have them locally produced, or would there be a monopoly on it?
No, that's a very good question. Also, when we conceive the product at the beginning, we say it has to be cheap, locally produced, and you don't throw it away when it doesn't work. You can fix it. So this device will cost probably less than $100. And in the same device, you have a digital stethoscope, an oximeter, plus a thermometer. Each single device costs more than $300. You have these three sensors in only one device for less than $100. The price, I think, is very competitive. It's good. Then you can, as I say, fix it, because you can make a 3D printing for most of the parts. When part is not working, you just remove it, you print it, you put it again, and then you fix your device. And then again, the plastic we are using can be recycled. So I think, yes, we have some advantages, cheap, can be fixed, and it's good for the planet.
Thank you very much, Professor Gervaix. We'll keep an eye on your device and the evolution.
Thank you.
Congratulations again to you and your team for winning the prize.
Thank you very much.